The sterile scent of disinfectant filled the air as Tasha Williams sat in the uncomfortable plastic chair of the emergency room waiting area. The fluorescent lights buzzed overhead, casting harsh shadows across her dark skin as she pressed a trembling hand against her chest. The pain had been building for hours, a crushing sensation that radiated down her left arm and up into her jaw. Every breath felt labored, every heartbeat irregular and frightening. She had driven herself to the hospital despite the protests of her brother Deshaun, who had wanted to call an ambulance. But Tasha knew better than most people how medical emergencies could bankrupt a family, even with insurance. She was practical, always had been, even when facing what she suspected might be a heart attack at 35 years old. The waiting room was crowded with the usual mix of late-night emergencies. A mother held a feverish toddler, an elderly man clutched his bandaged hand, and several people sat hunched over their phones, waiting for news about loved ones. Tasha tried to focus on the mundane details around her, anything to distract from the growing pressure in her chest. She had filled out the paperwork at the reception desk 20 minutes ago, describing her symptoms to Karen Phillips, a blonde receptionist who had barely looked up from her computer screen. Karen had handed her a clipboard with forms and told her to take a seat, that someone would call her name soon. That was nearly an hour ago. Tasha shifted in her seat, the plastic creaking under her weight. She was dressed simply in jeans and a navy blue sweater, her natural hair pulled back into a neat bun. She carried herself with quiet dignity, the kind that came from years of having to prove herself in rooms where she was often the only person who looked like her. Tonight, though, that dignity was being tested by waves of pain and the growing realization that her symptoms were being overlooked. Another patient was called back, a middle-aged white man who had arrived 30 minutes after Tasha. She watched him disappear through the double doors that led to the treatment area, her jaw tightening slightly. This wasn't the first time she had experienced this particular form of medical discrimination, but it had never felt quite so dangerous. The pressure in her chest intensified, and Tasha found herself gripping the armrest of the chair. She caught the eye of Linda Stevens, a nurse who was updating a chart near the reception desk. Linda glanced at her briefly, then looked away, returning to her paperwork as if Tasha were invisible. Finally, after what felt like an eternity, Tasha heard her name called. She stood slowly, her movements careful and measured despite the pain, and followed a different nurse through the doors into the emergency department. The nurse, a young woman with kind eyes, led her to a small triage room and began taking her vital signs. "Your blood pressure is elevated," the nurse noted, wrapping the cuff around Tasha's arm. "And your heart rate is a bit fast. Can you describe your symptoms again?" Tasha took a deep breath, though it caused a sharp pain to shoot through her chest. "I've been experiencing chest pain for about 3 hours now. It's a crushing sensation that radiates down my left arm and into my jaw. I'm also having some difficulty breathing and feeling nauseous." The nurse nodded, making notes on her chart. "Any family history of heart disease?" "Yes," Tasha replied. "My father had his first heart attack at 42. My grandmother died of heart disease at 58. The nurse's expression grew more concerned as she continued her assessment. "I'm going to get you set up in one of our examination rooms and have the doctor see you right away." But as Tasha was led to the examination room, she couldn't shake the feeling that her words had fallen on deaf ears. The nurse had been professional and thorough, but there was something in her manner that suggested she was simply going through the motions. Tasha had seen that look before, the one that said your pain isn't quite as real or urgent as others. The examination room was small and sterile, with harsh fluorescent lighting that made everything look washed out. Tasha settled onto the examination table, the paper crinkling beneath her as she tried to find a comfortable position. The pain in her chest had not subsided. If anything, it seemed to be getting worse. 20 minutes passed before the door finally opened, and Dr. Richard Blake entered. He was a tall, thin man in his 50s with graying hair and wire-rimmed glasses. His white coat was pristine, and he carried himself with the confident air of someone accustomed to being the smartest person in the room. He glanced at the chart in his hands before looking up at Tasha, his expression neutral but somehow dismissive. "Miss Williams," he said, settling onto a rolling stool without making eye contact, "I see you're here complaining of chest pain." The word complaining hit Tasha like a slap. She had described serious cardiac symptoms, symptoms that in any other patient would warrant immediate attention and testing. But somehow in Dr. Blake's mouth, they had been reduced to complaints. "That's correct," she replied evenly, her voice betraying none of the frustration building inside her. "I've been experiencing severe chest pain for several hours, along with pain radiating down my left arm and into my jaw. I'm also having trouble breathing." Dr. Blake nodded absently, still focused on the chart. "I see. And what do you think might have triggered this episode? Any unusual stress lately? Work problems? Relationship issues?" Tasha blinked, caught off guard by the question. She had expected him to ask about her medical history, her symptoms, her family history of heart disease. Instead, he was asking about stress, as if her physical symptoms were somehow psychosomatic. "I don't believe stress is the issue here, doctor," she said carefully. "These symptoms are consistent with cardiac distress. Given my family history and the nature of the pain, I think we should consider the possibility of a heart attack." Dr. Blake finally looked up from the chart, his eyebrows raised slightly as if he found her suggestion amusing. "Miss Williams," he said in a tone that was both condescending and dismissive, "I understand that you're concerned, but anxiety and stress can often manifest as physical symptoms. What you're describing sounds very much like a panic attack." Tasha felt a familiar anger rising in her chest, though she kept her voice steady. "Doctor, I'm not having a panic attack. I know the difference between anxiety and cardiac symptoms. This pain is severe, crushing, and it's been consistent for hours. I'm asking for proper cardiac testing." Dr. Blake sighed, as if dealing with a difficult child. "Young women your age rarely have heart attacks," he said. "What's much more common is anxiety, especially in high-stress situations. Have you been sleeping well, eating regularly? Sometimes when we don't take proper care of ourselves, our bodies respond with physical symptoms." The condescension in his voice was unmistakable now. Tasha could feel her jaw tightening as she struggled to maintain her composure. She had encountered this attitude before, the assumption that as a young black woman her symptoms were somehow less valid, less urgent, more likely to be psychological than physical. "Doctor," she said, her voice quiet but firm, "I'm experiencing classic symptoms of myocardial infarction, the crushing chest pain, the radiation to my arm and jaw, the difficulty breathing. These are not symptoms of anxiety. I'm requesting an EKG, blood work to check cardiac enzymes and appropriate cardiac monitoring." Dr. Blake's expression hardened slightly at her use of medical terminology. He leaned back in his chair, crossing his arms over his chest. "Miss Williams, I appreciate that you've done some internet research, but I think it's best to leave the medical diagnoses to the professionals. What I'm seeing here is a young woman who's worked herself into a state of anxiety and is now experiencing the physical manifestations of that stress." Internet research. The word stung more than Tasha had expected. Here she was, describing textbook cardiac symptoms with medical precision, and he was dismissing her knowledge as something she had Googled in a moment of panic. "I understand your expertise, doctor," she replied, her voice still controlled despite the growing frustration, "but I'm asking you to consider that these symptoms warrant cardiac evaluation. An EKG takes 5 minutes and could rule out or confirm cardiac involvement." Dr. Blake stood up abruptly, his movement sharp and impatient. "Miss Williams, I've been practicing emergency medicine for over 20 years. I think I'm qualified to distinguish between a medical emergency and an anxiety attack. What I'm going to recommend is that you go home, get some rest, and maybe see your primary care physician about anxiety management techniques. We can give you something to help you relax." He reached for his prescription pad, clearly intending to end the consultation. Tasha watched him in disbelief, the crushing pain in her chest now accompanied by a different kind of pressure, the weight of being dismissed and devalued by someone whose job it was to help her. "Dr. Blake," she said quietly, her voice carrying a note of warning that he seemed oblivious to, "I'm not leaving without a proper cardiac evaluation. I'm experiencing symptoms that could indicate a life-threatening condition, and I'm requesting appropriate testing." He looked up from his prescription pad, his irritation now clearly visible. "Miss Williams, I'm trying to help you here. What you're experiencing is very common among young women, especially those in high-pressure situations. The best thing you can do is go home, practice some relaxation techniques, and follow up with your primary care doctor if the symptoms persist." He handed her a prescription for anxiety medication, the paper fluttering slightly in his hand. "This will help with the physical symptoms you're experiencing. Take one as needed for anxiety, and you should feel much better." Tasha stared at the prescription without taking it. The pain in her chest was getting worse, but more than that, she could feel the familiar burn of injustice. How many women like her had been sent home from emergency rooms with anxiety medications instead of proper cardiac care? How many had suffered heart attacks because their symptoms were dismissed as hysteria or stress? "Doctor," she said, her voice taking on a steel edge that Dr. Blake was finally beginning to notice, "I want to be very clear about something. I am not taking this prescription, and I am not leaving this hospital without a proper cardiac evaluation. If you're unwilling to provide appropriate care, I need to speak with another physician." Dr. Blake's face flushed slightly, his professional composure beginning to crack. "Miss Williams," he said, his voice taking on a sharper tone, "I am the attending physician in this emergency department tonight. If you're not satisfied with my medical opinion, you're free to seek care elsewhere, but I'm not going to order unnecessary tests because a patient demands them." Unnecessary tests. The words echoed in Tasha's mind as she realized the full scope of what was happening. This wasn't just medical incompetence, it was discrimination so ingrained that Dr. Blake probably didn't even recognize it. In his mind, a young black woman complaining of chest pain was automatically less credible than other patients, her symptoms automatically less worthy of investigation. Tasha reached into her purse and pulled out her phone, her movements deliberate and calm. She began typing a message, her fingers moving with practiced efficiency across the screen. Dr. Blake watched her with growing irritation, clearly frustrated that his patient was not accepting his dismissal gracefully. "What exactly are you doing?" he asked, his voice tight with barely controlled anger. Tasha looked up from her phone, meeting his gaze with steady eyes. "I'm documenting this interaction," she said simply, "and I'm contacting someone who might be able to help ensure I receive appropriate medical care." Dr. Blake scoffed, shaking his head in disbelief. "This is ridiculous. I'm trying to help you, and you're acting like I'm the enemy here. If you want to waste time documenting a perfectly standard medical consultation, that's your choice, but it doesn't change my assessment." He moved toward the door, clearly intending to leave, but Tasha's next words stopped him in his tracks. "Dr. Blake," she said quietly, her voice carrying an authority that he was only beginning to recognize, "before you leave, I think there's something you should know about me." The fluorescent lights in the examination room seemed to buzz louder in the sudden silence that followed Tasha's words. Dr. Blake paused with his hand on the door handle, his body language radiating impatience and barely contained irritation. He turned back toward her, his expression a mixture of condescension and annoyance. "And what exactly should I know about you, Miss Williams?" he asked, his tone suggesting that nothing she could say would change his mind about her condition or his treatment plan. Tasha set her phone down on the examination table beside her, the screen still glowing from the message she had just sent. Her movements were calm and deliberate, a stark contrast to the chaos of pain and frustration that had been building inside her chest for the past several hours. "My name is Dr. Tasha Williams," she said quietly, her voice steady and clear. "I'm a board-certified cardiologist at Metropolitan Heart Institute, and I specialize in emergency cardiac interventions." The words hung in the air between them like a challenge thrown down. Dr. Blake's hand slowly slipped from the door handle as the implications of what she had just said began to sink in. His face went through a series of rapid changes, from skepticism to confusion to dawning realization. "You're a what?" he said, his voice barely above a whisper. "A cardiologist," Tasha repeated, her tone never wavering. "I've been practicing for 8 years, and I've personally treated hundreds of patients with the exact symptoms I've been describing to you tonight. Symptoms that you've dismissed as anxiety." Dr. Blake stood frozen in the doorway, his mind clearly racing as he tried to process this information. The confident, dismissive demeanor he had maintained throughout their interaction was beginning to crack, replaced by something that looked very much like panic. I had no idea," he stammered, his earlier authority completely evaporated. "Your chart just said Miss Williams, and I assumed—" "You assumed that a young black woman couldn't possibly have the medical knowledge to recognize her own cardiac symptoms," Tasha finished for him, her voice still calm, but now carrying an unmistakable edge. "You assumed that when I used medical terminology, it was because I had been Googling my symptoms rather than because I have a medical degree from Johns Hopkins and 8 years of specialized cardiac training." The color drained from Dr. Blake's face as the full weight of his mistake became clear. He had dismissed the concerns of a colleague, a specialist in the very field related to her symptoms. More than that, he had done so in a way that revealed his unconscious biases about race, gender, and credibility. "Dr. Williams," he said, his voice now uncertain and hesitant, "I sincerely apologize. I didn't realize you were a physician. If you had known, you would have taken my symptoms seriously?" Tasha interrupted, her composure finally beginning to crack slightly. "The question is, Dr. Blake, why should my credentials matter when it comes to receiving appropriate emergency medical care? Why should any patient have to reveal their profession before their symptoms are taken seriously?" Dr. Blake opened his mouth to respond, but no words came out. He stood there, caught between the door and the examination table, looking for all the world like a man who had just realized he was standing on the edge of a cliff. "The truth is," Tasha continued, her voice growing stronger, "I shouldn't have to be a cardiologist for you to take crushing chest pain seriously. I shouldn't have to have a medical degree for you to consider that a 35-year-old woman with a family history of heart disease might actually be having cardiac symptoms, but here we are." She reached into her purse and pulled out her hospital identification badge, the one that identified her as Dr. Tasha Williams, M.D., Cardiology Department, Metropolitan Heart Institute. She held it up so that Dr. Blake could read it clearly, the plastic reflecting the harsh fluorescent light. "This is who I am professionally," she said. "But more importantly, I'm a patient in your emergency room who has been experiencing concerning cardiac symptoms for over 3 hours. Symptoms that you've dismissed without so much as ordering an EKG." Dr. Blake's eyes fixed on the ID badge, and she could see him mentally calculating the implications of this situation. A cardiac specialist had presented to his emergency room with textbook heart attack symptoms, and he had dismissed her concerns as anxiety. The potential consequences of such a mistake were staggering, both medically and professionally. "Dr. Williams," he said again, his voice now shaky with what sounded like genuine fear, "I want to get you the appropriate tests immediately. Let me order an EKG, blood work, and everything you need." "Now you want to order tests?" Tasha asked, her eyebrows raised slightly. "What's changed in the last 5 minutes? My symptoms are exactly the same as they were when you were trying to send me home with anxiety medication." The question hung in the air, unanswered and unanswerable. They both knew what had changed. It wasn't her symptoms, her pain, or her medical condition. What had changed was Dr. Blake's perception of who she was, and that shift in perception had transformed her from a complaining patient into a colleague whose concerns needed to be taken seriously. "I made a mistake," Dr. Blake admitted, though his voice suggested he still didn't fully understand the scope of that mistake. "Let me make it right. What tests do you want me to order?" Tasha studied his face for a long moment, seeing the panic and confusion there. Part of her felt almost sorry for him, this man who was clearly out of his depth and struggling to understand how he had ended up in this situation. But her sympathy was tempered by the knowledge that she was not his first patient to be dismissed, and she would not be his last unless something fundamental changed. "Dr. Blake," she said finally, her voice taking on the tone she used when teaching medical students, "I want you to think about what just happened here. I presented with classic acute coronary syndrome symptoms: crushing chest pain, radiation to the arm and jaw, dyspnea, family history of cardiac disease. These are textbook presentations that any emergency physician should recognize and act upon immediately." Dr. Blake nodded mutely, his face growing paler with each symptom she listed. "Instead," Tasha continued, "you immediately assumed my symptoms were psychosomatic. You didn't take a proper history, you didn't perform a physical examination, and you didn't order any diagnostic tests. You were prepared to send me home with anxiolytics based solely on your assumptions about who I was and what I was likely to be experiencing. I understand that I made an error in judgment," Dr. Blake said weakly, his professional training finally kicking in enough for him to attempt some form of damage control. "Can we please proceed with appropriate testing now?" Tasha nodded slowly, but her expression remained serious. "Yes, we can proceed with testing, but I want you to understand something important. This isn't just about me, and it's not just about tonight. This is about a pattern of discrimination in emergency medicine that puts patients at risk every single day." She paused, letting her words sink in before continuing. "How many other women have you sent home from this emergency room without a proper cardiac evaluation? How many Black patients have had their pain dismissed as exaggerated or psychosomatic? How many people have suffered preventable complications because their symptoms weren't taken seriously?" Dr. Blake's jaw worked silently as he struggled to process her questions. The truth was uncomfortable and undeniable. This wasn't an isolated incident. It was part of a systemic problem that he had been unconsciously perpetuating throughout his career. The door to the examination room opened suddenly, and Linda Stevens, the nurse who had barely glanced at Tasha in the waiting room, appeared in the doorway. She looked between Dr. Blake and Tasha, clearly sensing the tension in the room. "Dr. Blake," Linda said hesitantly, "is everything all right? The patient in room 3 is asking for an update, and there's been a delay with the cardiac tests you ordered for Mrs. Johnson." The irony of the moment was not lost on Tasha. Here was Linda, efficiently managing the care of other patients, following up on cardiac tests that had been ordered promptly for someone else. The contrast with her own experience could not have been more stark. "Linda," Dr. Blake said, his voice unsteady, "I need you to set up for a complete cardiac workup in this room immediately. EKG, cardiac enzymes, chest X-ray, the full protocol." Linda's eyebrows rose slightly at the urgency in his voice. "Of course, doctor. Is this for Miss Williams?" "It's Dr. Williams," Tasha corrected quietly, her voice carrying just enough emphasis to make the point clear. Linda looked confused for a moment, then glanced at the ID badge that Tasha was still holding. Her expression changed rapidly as she processed what she was seeing. "Oh," Linda said, her voice suddenly much more respectful. "I'm sorry, Dr. Williams. I'll get everything set up right away." As Linda hurried from the room, Dr. Blake turned back to Tasha, his expression a mixture of embarrassment and dawning understanding. The ripple effects of his mistake were already beginning to spread, and he was starting to realize that this incident would not end with a simple apology and a few belated tests. "Dr. Williams," he said, his voice more formal now, "I want to assure you that you'll receive the highest level of care. Is there anything specific you'd like me to focus on given your expertise in this area?" Tasha almost smiled at the question. An hour ago, he had been dismissing her medical knowledge as internet research. Now he was deferring to her expertise and asking for her professional opinion about her own care. "What I'd like, Dr. Blake," she said, "is for you to treat me exactly the way you would treat any other patient presenting with these symptoms. No special consideration because of my profession, just appropriate, competent emergency medical care. She paused, then added, and I'd like you to document this interaction thoroughly in my medical record. Every decision you made, every assumption you formed, and every step of your thought process. Because this case is going to be reviewed very carefully by people who need to understand exactly what happened here tonight. Dr. Blake's face went white as the implications of her words hit him. A documented case of medical discrimination involving a physician patient who had been dismissed and nearly sent home during what could be a cardiac event would be devastating for his career and the hospital's reputation. The room fell silent except for the persistent buzzing of the fluorescent lights overhead. Tasha could feel the crushing pain in her chest continuing, a constant reminder that while they had been having this conversation about discrimination and professional accountability, she was still a patient in need of medical care. Her phone buzzed with an incoming message, and she glanced down at the screen. The response to her earlier text had arrived, and she could see that the wheels she had set in motion were already beginning to turn. "Dr. Blake," she said, looking up from her phone. "I think you should know that Dr. Robert Mitchell from Hospital Administration will be joining us shortly. I contacted him when it became clear that I wasn't receiving appropriate care." Dr. Blake's face somehow managed to get even paler. Hospital administration involvement meant that this incident would be formally investigated, documented, and reviewed. His career, his reputation, and potentially his license were now on the line. "I also contacted my colleague, Dr. Jamal Washington, who's the head of cardiology at Metropolitan," Tasha continued. "He's on his way to ensure that I receive appropriate specialist consultation if needed." The examination room door opened again, and Linda returned with a cart full of equipment. Behind her came another nurse who immediately began setting up the EKG machine. The sudden flurry of efficient, professional activity was a stark contrast to the dismissive treatment Tasha had received just minutes earlier. As the nurses worked to prepare for her cardiac evaluation, Tasha watched Dr. Blake standing frozen in the corner of the room. His entire demeanor had changed from confident authority to barely controlled panic. The man who had been so certain of his diagnosis just minutes ago now looked lost and uncertain. "Dr. Blake," she said quietly, drawing his attention back to her, "I want you to understand something. This isn't about revenge or trying to destroy your career. This is about ensuring that what happened to me tonight doesn't happen to other patients." He nodded silently, though she could see in his eyes that he was still primarily concerned about the professional consequences he was facing. "Every year, thousands of women die from heart attacks because their symptoms are dismissed or misdiagnosed," Tasha continued. "Black women are particularly at risk because medical professionals often don't take their pain seriously. What happened here tonight is part of a much larger problem in healthcare." The EKG leads were attached to her chest now, and she could hear the familiar beeping of the cardiac monitor as it began displaying her heart rhythm. Even without looking at the screen, she could tell from the sound that something was wrong. The rhythm was irregular, and there were clear changes that suggested cardiac involvement. "Dr. Blake," she said, her voice taking on a new urgency, "I need you to look at this EKG now." He moved quickly to the monitor, his medical training finally overriding his panic. As he studied the readout, his face went pale for entirely different reasons. "Dr. Williams," he said, his voice barely above a whisper, "this shows significant ST elevation. You're having an acute myocardial infarction." The words hung in the sterile air of the examination room like a death sentence. Acute myocardial infarction, the medical term for what most people simply call a heart attack. Dr. Blake stared at the EKG monitor, his hands trembling slightly as the full magnitude of his mistake became brutally clear. Tasha looked at the monitor herself, her trained eye immediately recognizing the telltale signs she had been trying to explain to Dr. Blake for the past hour. The ST elevations were unmistakable, indicating that her heart muscle was being damaged by a lack of blood flow. Every minute that passed without intervention meant more of her heart was dying. "How long have you been experiencing these symptoms?" Dr. Blake asked, his voice now stripped of all the condescension and dismissiveness from earlier. The question was urgent, professional, focused entirely on the medical emergency unfolding before them. "I told you earlier," Tasha replied, her voice strained as another wave of pain crashed through her chest. "Over 3 hours now, since approximately 7:30 this evening." Dr. Blake's face went ashen as he calculated the time that had been lost. In cardiac care, time was muscle. The longer a heart attack went untreated, the more permanent the damage occurred. He had wasted precious time dismissing her symptoms, time that could mean the difference between full recovery and permanent cardiac disability. "We need to activate the cardiac catheterization lab immediately," he said, turning to Linda, who was still in the room. "Call the on-call interventional cardiologist and tell them we have a STEMI that needs emergent intervention." Linda nodded and reached for the phone, but Tasha's voice stopped her. "Wait," Tasha said, her breathing becoming more labored as the pain intensified. "Dr. Blake, I need you to call Dr. James Patterson at Metropolitan Heart Institute. He's the best interventional cardiologist in the city, and he's someone I trust with my life." Dr. Blake hesitated for a moment. Hospital protocols typically dictated using their own on-call specialists, but given the circumstances and the potential liability issues surrounding this case, he wasn't about to argue with his patient's preferences. "Of course," he said quickly. "Linda, get Dr. Patterson on the line immediately. Tell him Dr. Tasha Williams is having an acute STEMI and needs emergency transport to Metropolitan for immediate cardiac catheterization." As Linda hurried to make the call, Dr. Blake turned his attention to the immediate medical needs. Tasha could see him struggling to shift into full emergency mode while still processing the implications of what had happened. "Dr. Williams, I'm starting you on aspirin, clopidogrel, and heparin," he said, his hands moving efficiently as he prepared medications. "We need to get some IV access and start cardiac monitoring protocols." Tasha nodded, her medical training helping her stay focused despite the crushing pain and the surreal nature of being both doctor and patient in this moment. She watched Dr. Blake work, noting that his technical skills were competent even if his diagnostic judgment had been catastrophically flawed. The pain in her chest was becoming unbearable now, radiating down both arms and making it difficult to breathe. She could feel her heart racing irregularly, and she knew that every moment of delay was causing irreversible damage to her cardiac muscle. "Dr. Blake," she managed to say between labored breaths, "I need morphine for the pain, and we should consider nitrates if my blood pressure can tolerate it." He nodded, already reaching for the pain medication. As he prepared the injection, she could see his hands shaking slightly. The confident physician who had dismissed her symptoms an hour ago was now clearly rattled by the enormity of his mistake. The examination room door burst open, and Dr. Robert Mitchell, the hospital administrator, strode in. He was a tall, distinguished man in his 60s with silver hair and the bearing of someone accustomed to handling crises. His expression was grim as he took in the scene before him. "Dr. Blake," he said, his voice cold and authoritative, "I understand we have a situation here that requires my immediate attention." Behind him came another figure that made Dr. Blake's face go even paler. Dr. Jamal Washington was an imposing man with the quiet confidence that came from being one of the most respected cardiologists in the state. His dark eyes immediately went to the cardiac monitor, reading Tasha's heart rhythm with expert precision. "Tasha," Jamal said, his voice filled with concern as he moved to her bedside, "what's your pain level right now?" 8 out of 10, she replied, grateful to see a familiar face and someone she trusted completely. "The pain's been consistent for over 3 hours now, and it's getting worse." Jamal's jaw tightened as he looked at the EKG readout and then at Dr. Blake. 3 hours, he repeated, his voice carrying a dangerous edge. "And when did Dr. Blake first see you?" "About 90 minutes ago," Tasha said, her voice getting weaker as the cardiac medication began to take effect. "He initially diagnosed anxiety and tried to send me home with medication." The silence that followed was deafening. Dr. Mitchell's face hardened as the implications became clear, while Dr. Blake looked as though he wanted to disappear into the floor. "Dr. Blake," Jamal said, his voice controlled but carrying an unmistakable threat, "are you telling me that you saw a patient presenting with classic acute coronary syndrome symptoms and diagnosed anxiety?" I made an error in judgment," Dr. Blake stammered, his earlier confidence completely evaporated. "I didn't properly assess the situation." "An error in judgment," Dr. Mitchell repeated, his voice flat and cold. "Doctor, do you understand that this patient is a respected member of our medical community? Do you understand the severity of what you've done?" The room fell silent except for the beeping of the cardiac monitors and Tasha's labored breathing. She could see Dr. Blake struggling to formulate a response, his career flashing before his eyes as the full consequences of his actions became clear. "Right now," Jamal said firmly, "our priority needs to be getting Dr. Williams to Metropolitan for emergency intervention. We can discuss the circumstances that led to this delay after we've addressed the immediate medical crisis." He turned to Tasha, his expression softening with concern. "The ambulance is en route, and Dr. Patterson is already in the cardiac lab preparing for your arrival. We're going to take excellent care of you." Tasha nodded, feeling a mix of relief and lingering anger. She was finally going to get the treatment she needed, but the damage from the delay had already been done. Her heart had been suffering for hours longer than necessary because of one man's biases and assumptions. "Dr. Blake," Dr. Mitchell said, his voice carrying the weight of administrative authority, "I need you to step outside. We'll be conducting a full investigation into this incident, and I don't want you involved in Dr. Williams' care from this point forward." "But I should continue to monitor," Dr. Blake began, but Dr. Mitchell cut him off with a sharp gesture. "You should have been monitoring her condition 3 hours ago when she first presented with symptoms," Dr. Mitchell said coldly. "Your involvement in this case ends now." Dr. Blake stood frozen for a moment, clearly wanting to argue but recognizing that he had no ground to stand on. Finally, he moved toward the door, pausing only to look back at Tasha with what appeared to be genuine remorse. "Dr. Williams," he said quietly, "I am truly sorry. I failed you as a physician and as a colleague." Tasha looked at him through the haze of pain and medication, seeing a man whose world had just collapsed around him. Part of her felt sympathy for his obvious distress, but a larger part of her thought about all the other patients who had suffered because of similar dismissive attitudes. "Dr. Blake," she said, her voice weak but clear, "the question isn't whether you're sorry. The question is what you're going to do to make sure this never happens to another patient." Before he could respond, the ambulance crew arrived, wheeling a stretcher into the room with professional efficiency. The lead paramedic, a woman with steady hands and kind eyes, immediately began assessing Tasha's condition while coordinating with Jamal about the transport. "Dr. Williams," the paramedic said, "I'm Sarah, and we're going to get you to Metropolitan as quickly and safely as possible. Dr. Patterson is waiting for you, and everything is ready for your procedure." As they transferred Tasha to the stretcher, she caught sight of Dr. Blake standing in the hallway outside the examination room. He looked lost and broken, a stark contrast to the confident physician who had dismissed her symptoms earlier. She knew that his career would likely never recover from this incident, and that knowledge brought her no satisfaction. This wasn't about revenge, it was about accountability and change. The ambulance ride to Metropolitan Heart Institute was a blur of sirens, medical equipment, and urgent radio communications with the cardiac catheterization lab. Tasha drifted in and out of consciousness as the morphine took effect, but her medical training kept part of her mind alert and analytical. She could hear the paramedics discussing her vital signs, could feel the irregular rhythm of her heart as it struggled with the ongoing damage. Jamal rode with her in the ambulance, his presence a comforting reminder that she was now in the hands of people who would take her condition seriously. He held her hand during the worst waves of pain, his voice steady and reassuring as he explained what would happen when they reached the hospital. "We're going to take you straight to the cardiac lab," he said, his voice cutting through the haze of pain and medication. "Dr. Patterson is one of the best interventional cardiologists in the country. He's going to open up the blocked artery and restore blood flow to your heart." Tasha squeezed his hand weakly, grateful for his expertise and his friendship. "How much damage do you think has been done?" she asked, though she already suspected the answer from her own knowledge of cardiac medicine. Jamal's expression was carefully neutral, but she could see the concern in his eyes. "We won't know the full extent until after the procedure," he said diplomatically. "But Dr. Patterson is excellent at what he does, and we caught this in time to make a significant difference." The ambulance pulled into the emergency bay at Metropolitan Heart Institute, and suddenly Tasha was surrounded by a team of medical professionals who moved with practiced efficiency. Dr. Patterson was waiting for them, a tall man with silver hair and steady hands who immediately took charge of her care. "Dr. Williams," he said, his voice calm and authoritative, "I've reviewed your EKG and we're going to get you to the lab immediately. The good news is that you're young and otherwise healthy, which works in your favor for recovery." As they wheeled her through the familiar hallways of Metropolitan, Tasha felt a strange mixture of relief and surreal detachment. This was her workplace, her second home, but she was seeing it now from an entirely different perspective. The corridors she had walked countless times as a physician were now rushing past her as she lay on a stretcher, fighting for her life. The cardiac catheterization lab was a high-tech environment filled with monitors, imaging equipment, and specialized tools. The team that surrounded her moved with choreographed precision, each person knowing exactly their role in the procedure that could save her life. "Dr. Williams," Dr. Patterson said as they prepared her for the procedure, "I'm going to give you conscious sedation so you'll be comfortable but awake during the procedure. This will allow me to communicate with you if necessary and ensure that everything goes smoothly." Tasha nodded, her medical training helping her understand exactly what was happening even as she experienced it as a patient. She could feel the local anesthetic being administered to her groin, where they would insert the catheter, and could see the large imaging screens that would soon show the inside of her coronary arteries. The procedure began with Dr. Patterson threading a thin catheter through her femoral artery and up into her heart. Tasha watched the monitors, her trained eye following the progress of the catheter as it navigated through her vascular system. Despite the circumstances, there was something fascinating about seeing her own cardiac anatomy displayed in real time on the screens around her. "There it is," Dr. Patterson said, his voice focused as he identified the blocked artery on the imaging screen. "You have a complete occlusion of the left anterior descending artery. That's what we call the widowmaker because it's such a critical vessel." Tasha felt a chill as she heard the diagnosis. The left anterior descending artery supplied blood to a large portion of the heart's left ventricle, the main pumping chamber. A complete blockage in that vessel was indeed life-threatening, and she realized how close she had come to a fatal outcome. "I'm going to place a stent to open up the artery and restore blood flow," Dr. Patterson continued, his hands moving with expert precision as he maneuvered the equipment. "You should start feeling better almost immediately once we get this opened up." Tasha watched in fascination as a tiny balloon was inflated inside her blocked artery, crushing the clot and plaque that had been preventing blood flow. The difference was immediate and dramatic. The crushing chest pain that had been her constant companion for hours suddenly began to ease, replaced by a sensation of relief that was almost overwhelming. "Blood flow is restored," Dr. Patterson announced to the team, his voice carrying a note of satisfaction. "The stent is in perfect position, and we're seeing excellent flow through the vessel." On the monitors, Tasha could see her coronary artery now flowing freely, the contrast dye highlighting the restored circulation to her heart muscle. It was a sight that never got old, even from this unusual perspective as the patient, rather than the physician. "How are you feeling, Dr. Williams?" Dr. Patterson asked, his attention shifting from the technical aspects of the procedure to her overall condition. "Much better," Tasha replied, her voice stronger now than it had been in hours. "The chest pain is almost completely gone." "Excellent," he said, beginning the process of removing the catheter and closing the access site. "The procedure was successful and we were able to restore full blood flow to your heart. You should make a complete recovery with appropriate follow-up care." As the medical team worked to complete the procedure and prepare her for transfer to the cardiac care unit, Tasha found herself thinking about the events that had led to this moment. She was alive and would recover fully, but the delay in treatment could have had catastrophic consequences. How many other patients had not been as fortunate? How many had suffered permanent disability or death because their symptoms were dismissed or minimized? The cardiac care unit at Metropolitan Heart Institute was a place Tasha knew well from her professional life, but experiencing it as a patient gave her an entirely different perspective. The constant beeping of monitors, the careful attention of nurses checking vital signs every few hours, the restricted activity that felt foreign to someone accustomed to being constantly in motion, all of it served as a stark reminder of how close she had come to a very different outcome. It had been 18 hours since her emergency cardiac catheterization, and she was feeling remarkably better. The chest pain was gone, replaced by the minor discomfort from the procedure site in her groin. Her heart rhythm had stabilized, and the cardiac enzymes that measured heart muscle damage were trending downward, indicating that the intervention had been successful in limiting the extent of the damage. Jamal sat in the chair beside her bed, reviewing her chart and monitoring her progress with the careful attention of both a colleague and a friend. His presence had been a constant source of comfort since the crisis began, and she was grateful for his expertise and support. "The echo results look good," he said, setting down the report he had been studying. "There's some minor wall motion abnormality in the area that was affected, but your overall heart function is preserved. Dr. Patterson did excellent work getting that artery opened quickly." Tasha nodded, feeling a mixture of relief and lingering anger about what had happened. "I keep thinking about the delay," she said quietly. 3 hours, Jamal. 3 hours of my heart muscle dying while Dr. Blake insisted I was having anxiety." Jamal's expression darkened at the mention of Dr. Blake's name. The man had made a catastrophic error in judgment. One could have cost Tasha her life. But more than that, his actions had revealed the kind of unconscious bias that put countless patients at risk every day. "I spoke with Dr. Mitchell this morning," Jamal said, his voice carefully controlled. "Dr. Blake has been suspended pending a full investigation. The hospital is taking this very seriously, especially given the circumstances and the potential liability issues." Tasha sighed, feeling conflicted about the news. Part of her was satisfied that there would be consequences for Dr. Blake's actions, but another part of her worried that focusing on one individual would miss the larger systemic issues at play. "It's not just about Blake," she said, shifting slightly in the hospital bed. "He's a symptom of a much bigger problem. How many other emergency physicians have similar biases? How many other patients have been dismissed because they don't fit the expected profile?" Before Jamal could respond, there was a soft knock on the door. Dr. Mitchell entered, followed by a woman Tasha didn't recognize, an elegant African-American woman in her 50s wearing a sharp business suit. "Dr. Williams," Dr. Mitchell said, his voice formal but respectful. "I'd like you to meet Dr. Tanya Cooper. She's the chief medical officer for our hospital system, and she's here to discuss the incident from yesterday evening." Dr. Cooper stepped forward, her expression serious but compassionate. "Dr. Williams," she said, extending her hand, "I want to begin by expressing our deepest apologies for what you experienced. What happened in our emergency department was completely unacceptable and contrary to everything we stand for as a medical institution." Tasha shook her hand, studying the woman's face for signs of sincerity. She had dealt with hospital administrators before, and she knew how to distinguish between genuine concern and damage control. "I appreciate that, Dr. Cooper," she said carefully. "But I hope you understand that this isn't just about an apology. This is about systematic changes that need to happen to prevent other patients from experiencing what I went through. Dr. Cooper nodded, settling into a chair across from Tasha's bed. That's exactly why I'm here, she said. We want to understand not just what happened, but why it happened, and what we can do to ensure it never happens again. She opened a tablet and began reviewing notes. I've spoken with Dr. Blake at length, and I've reviewed the entire sequence of events from your arrival in the emergency department through your transfer to Metropolitan. What I'm seeing is a pattern of unconscious bias that led to dangerous assumptions about your condition. Tasha felt a spark of hope at Dr. Cooper's words. It was rare to hear a hospital administrator acknowledge the role of bias so directly, and it suggested that they might actually be serious about making meaningful changes. Dr. Blake admitted that he made assumptions about your symptoms based on your age, race, and gender. Dr. Cooper continued. He assumed that a young black woman complaining of chest pain was more likely to be experiencing anxiety than having a cardiac event, despite your clear description of classic heart attack symptoms. The room fell silent as the implications of Dr. Cooper's words settled over them. It was one thing to suspect that bias had played a role in Tasha's treatment, but hearing it acknowledged so directly was both validating and deeply disturbing. What's particularly troubling, Dr. Cooper went on, is that this wasn't an isolated incident. Our investigation has revealed several other cases where Dr. Blake showed similar patterns of dismissive treatment toward minority patients, particularly women. Jamal leaned forward in his chair, his expression grim. How many other patients are we talking about? He asked. Over the past 2 years, at least 12 documented cases where minority patients' pain complaints were dismissed or undertreated compared to similar presentations in white patients, Dr. Cooper replied. None of them resulted in outcomes as serious as what Dr. Williams experienced, but the pattern is clear and concerning. Tasha felt a cold anger settling in her chest. 12 other patients who had been dismissed, whose pain had been minimized, whose symptoms had been attributed to anxiety or drug-seeking behavior rather than legitimate medical concerns. How many more cases had gone undocumented or unrecognized? What are you going to do about it? She asked, her voice carrying a steely edge that made everyone in the room sit up straighter. Dr. Cooper consulted her tablet again before responding. Dr. Blake has been terminated effective immediately, she said. His medical license will be reported to the state board for review, and he will not be practicing medicine at any facility in our health system. That's a start, Tasha replied. But firing one doctor doesn't address the systemic issues that allowed this to happen in the first place. You're absolutely right, Dr. Cooper agreed. That's why we're implementing a comprehensive bias training program for all emergency department staff. We're also establishing new protocols for cardiac symptom evaluation that will require specific documentation when standard testing is not performed. Dr. Mitchell cleared his throat, clearly uncomfortable with the direction of the conversation. Dr. Williams, he said, we're also prepared to discuss compensation for the pain and suffering you've experienced, as well as any ongoing medical expenses related to this incident. Tasha looked at him with barely concealed disdain. This isn't about money, Dr. Mitchell, she said firmly. This is about making sure that no other patient has to go through what I went through. She turned back to Dr. Cooper, her expression intense. I want to be involved in developing these new protocols, she said. I want to review the training materials, and I want regular reports on how these changes are being implemented and measured. Dr. Cooper nodded immediately. We would be honored to have your expertise and insight in developing these improvements, she said. Your perspective as both a physician and a patient who experienced this discrimination firsthand would be invaluable. The door opened again, and this time it was Deshaun, Tasha's younger brother, who entered with a mixture of concern and barely controlled anger on his face. He had been at her bedside through most of the night, and she could see the exhaustion and worry in his eyes. How are you feeling, sis? He asked, moving to her bedside and taking her hand. Much better, she replied, squeezing his hand reassuringly. The doctors say I'm going to make a full recovery. Deshawn's expression hardened as he looked at Dr. Mitchell and Dr. Cooper. "And what about the doctor who nearly killed her?" he asked, his voice tight with anger. "What's being done about him?" Dr. Cooper repeated the information about Dr. Blake's termination and the investigation into his past treatment patterns. Deshawn listened with growing anger, his jaw tightening as he processed the scope of what had happened. 12 other patients, he said, his voice rising slightly. "This man has been discriminating against patients for years and nobody noticed? How is that possible?" The question hung in the air, unanswered and uncomfortable. It was one thing to acknowledge that bias existed in healthcare, but quite another to confront the reality that systematic discrimination had been occurring under their noses for years without being adequately addressed. "Mr. Williams," Dr. Cooper said carefully, "you raise an important point. Our investigation has revealed gaps in our oversight and quality assurance processes that allowed these patterns to continue undetected. We're implementing new monitoring systems to identify and address such issues more quickly in the future." "That's great for future patients," Deshawn replied sarcastically. "But what about my sister? What about the other people who were hurt by this man's prejudices?" Tasha squeezed her brother's hand, appreciating his anger on her behalf, but also recognizing that productive change would require more than emotional outrage. "Deshawn," she said gently, "I understand your anger, and I share it. But right now, I want to focus on making sure this doesn't happen to anyone else." She looked around the room at the assembled administrators and medical professionals. "This incident has shown us that we have serious problems in our healthcare system, problems that go far beyond one individual physician. We need systematic changes that address the root causes of medical bias and discrimination." Dr. Cooper nodded emphatically. "We're committed to making those changes, Dr. Williams. Your experience has been a wake-up call for our entire organization." But Tasha wasn't finished. "I want quarterly reports on the implementation of these new protocols," she said, her voice taking on the authoritative tone she used in professional settings. "I want data on patient satisfaction scores broken down by demographics. I want to see evidence that these changes are actually making a difference." The room fell silent as everyone processed the scope of Tasha's demands. She wasn't just asking for apologies and promises. She was demanding accountability and measurable results. "You'll have all of that," Dr. Cooper said finally. "We recognize that words are not enough. We need to demonstrate through our actions and our results that we're serious about change." As the meeting concluded and the administrators filed out of the room, Tasha leaned back against her pillows, feeling emotionally drained but cautiously optimistic. The road ahead would be long, and changing institutional bias would require sustained effort and commitment. But for the first time since this ordeal began, she felt like she might be able to make a real difference. 3 months after her heart attack, Dr. Tasha Williams sat in the conference room at Metropolitan Heart Institute, reviewing the quarterly report on emergency department protocols that Dr. Cooper had promised. The data spread across the table told a story of gradual but meaningful change, the kind of progress that could only come from sustained institutional commitment. Patient satisfaction scores had improved across all demographic groups, but the improvement was most pronounced among African American women, the group that had previously reported the lowest levels of satisfaction with emergency care. More importantly, the time to cardiac evaluation for patients presenting with chest pain had been standardized, eliminating the dangerous delays that had nearly cost Tasha her life. Jamal sat across from her, reviewing a separate report on cardiac outcomes in the regional hospital system. The changes implemented at their hospital had been so successful that other facilities were beginning to adopt similar protocols, creating a ripple effect of improvement throughout the medical community. "These numbers are impressive," he said, looking up from the data. "Emergency department complaints related to dismissed symptoms are down 60%. And patient satisfaction scores have improved across the board." Tasha nodded, feeling a sense of satisfaction that went beyond personal vindication. The work they had done over the past 3 months had been exhausting, involving countless meetings, training sessions, and protocol reviews. But seeing the measurable impact on patient care made all of that effort worthwhile. Dr. Cooper entered the conference room, carrying her own copy of the quarterly report and wearing an expression of cautious optimism. The changes they had implemented were working, but she knew that maintaining this progress would require ongoing vigilance and commitment. "Dr. Williams," she said, settling into her chair, "I wanted to personally thank you for your involvement in this process. The improvements we've seen are directly attributable to your insights and recommendations." Tasha looked up from the report, her expression serious but pleased. "The data is encouraging, Dr. Cooper, but we can't let our guard down. Changing institutional culture is a long-term process, and we need to maintain this level of attention and accountability." "Absolutely," Dr. Cooper agreed. "That's why I wanted to discuss the next phase of our improvement efforts with you." She opened her tablet and pulled up a presentation that outlined plans for expanding the bias training and protocol improvements to other departments throughout the hospital system. The success they had achieved in the emergency department was just the beginning of a much larger transformation effort. "We're seeing similar patterns of disparate treatment in other areas," Dr. Cooper explained. "Pain management, obstetrics, and psychiatric care, there are documented disparities in how patients are treated based on race, gender, and socioeconomic status." The scope of the problem was both daunting and infuriating, but Tasha found herself energized by the challenge. Her experience had opened her eyes to the pervasive nature of medical bias, and she was determined to be part of the solution. "I'd like to propose something," she said, her voice taking on the focused intensity that her colleagues had learned to recognize. "What if we created a permanent position focused on health equity and bias reduction? Someone whose full-time job would be monitoring these issues and ensuring that our improvements are sustained and expanded." Dr. Cooper's eyes lit up at the suggestion. "That's an excellent idea," she said. "Do you have someone in mind for such a position?" Tasha smiled slightly, having anticipated the question. "Actually, I do. I'd like to be considered for the role myself." The room fell silent as the implications of her statement sank in. Tasha was proposing to leave her lucrative cardiology practice to focus full-time on addressing medical bias and improving healthcare equity. It was a significant career change, but one that felt like a natural evolution of the work she had been doing since her heart attack. Jamal looked at her with a mixture of surprise and admiration. "Are you serious about this?" he asked. "You'd be giving up clinical practice to focus on administrative and policy work." "Not giving up," Tasha replied. "Evolving. My experience showed me that individual excellence in patient care isn't enough if the system itself is biased against certain patients. I want to work on fixing the system." Dr. Cooper was already taking notes, clearly excited by the possibility. "We would need to create the position formally, get approval from the board, establish appropriate compensation and authority levels," she said, thinking out loud. "But I think this could be exactly what we need to ensure long-term success." Over the following weeks, the proposal moved through the hospital's administrative processes with surprising speed. The board of directors, still reeling from the publicity surrounding Tasha's case and eager to demonstrate their commitment to change, approved the new position unanimously. Dr. Tasha Williams was officially appointed as the hospital system's first Director of Health Equity and Patient Advocacy, a role that would give her authority to investigate complaints, review treatment patterns, and implement system-wide improvements to address medical bias. Her first major initiative was the establishment of patient advocacy rounds, where she would personally follow up with patients from underrepresented communities to ensure they were receiving appropriate care. It was a proactive approach that identified problems before they escalated to the level of medical emergencies or formal complaints. The program's success was evident within the first month. Several cases of undertreated pain in minority patients were identified and corrected. Potential cardiac events were properly evaluated rather than dismissed. and patient satisfaction scores continued to improve across all demographic groups. Word of the hospital's transformation began to spread throughout the medical community. Other institutions reached out to learn about their protocols and training programs, and Tasha found herself speaking at medical conferences about the importance of addressing bias in healthcare. 6 months after her heart attack, she stood before an audience of emergency medicine physicians at a national conference, sharing her story and the lessons learned from her experience. The auditorium was packed, with doctors hanging on every word as she described the night that nearly cost her life. "The physician who dismissed my symptoms wasn't a bad person," she told the audience. "He was a competent doctor who had been trained to recognize and treat cardiac emergencies. But his unconscious biases prevented him from seeing what was right in front of him, a patient in crisis who needed immediate intervention." She clicked to the next slide in her presentation, showing the data from their hospital's improvement efforts. "The results speak for themselves," she continued. "When we acknowledge that bias exists and take systematic steps to address it, patient outcomes improve dramatically." After her presentation, Tasha was approached by dozens of physicians who shared similar stories from their own institutions. The problem of medical bias was widespread, but so was the desire among healthcare professionals to address it effectively. One young emergency medicine resident, a black woman who reminded Tasha of herself at that age, approached with tears in her eyes. "Dr. Williams," she said, "your story gives me hope. I've experienced dismissive treatment from colleagues and supervisors, and I've seen patients treated differently because of their race or gender. Knowing that change is possible, that we can actually make things better, it means everything to me." Tasha smiled, remembering the fear and isolation she had felt as a young physician navigating similar challenges. "Change is not only possible," she replied. "It's inevitable when good people decide they've had enough of the status quo." A year after her heart attack, Tasha received a call that brought the entire experience full circle. Dr. Blake, the physician who had dismissed her symptoms, had requested a meeting. He had spent the year since his termination in therapy examining his own biases and working to understand how his assumptions had nearly cost a patient her life. They met at a coffee shop near the hospital, a neutral location where they could speak openly without the weight of institutional politics. Dr. Blake looked older than she remembered, his face lined with stress and what appeared to be genuine remorse. "Dr. Williams," he began, his voice uncertain, "I don't expect forgiveness, and I don't expect you to believe that I've changed. But I wanted you to know that what happened that night has fundamentally altered how I see medicine and how I see myself." Tasha studied his face, looking for signs of sincerity or manipulation. What she saw was a man who had been broken by the consequences of his actions and was genuinely trying to rebuild himself into something better. "What are you doing now?" she asked, her voice neutral but not hostile. "I'm working at a community clinic in an underserved area," he replied. "It's volunteer work, mostly patients without insurance who have been failed by the system in various ways. I'm learning things about medicine and about people that I never understood before." He paused, struggling to find the right words. "I want you to know that I think about that night every day," he continued. "Not just because it ended my career at the hospital, but because I nearly killed someone through my own prejudices and assumptions. That's not the kind of doctor I thought I was, but it's exactly the kind of doctor I had become." Tasha felt a complex mixture of emotions as she listened to him speak. Part of her was still angry about what had happened, about the pain and danger she had experienced because of his biases. But another part of her recognized the courage it took for him to confront his mistakes so directly. "Dr. Blake," she said finally, "I appreciate you reaching out, and I hope you continue to grow from this experience. But I want you to understand something important. This was never about destroying your career or getting revenge. This was about making sure that no other patient has to experience what I experienced." "I understand that now," he replied. "And I want you to know that the work you're doing, the changes you've implemented, they're making a real difference." I've heard about them from colleagues throughout the medical community. They talked for another hour, discussing the systemic changes that had been implemented and the ongoing work needed to address medical bias. It wasn't a comfortable conversation, but it was an important one, demonstrating that even the most entrenched biases could be confronted and changed with sufficient commitment and effort. As they prepared to leave, Dr. Blake made one final request. If there's ever an opportunity for me to contribute to the work you're doing, to help other physicians recognize and address their biases, I'd like to be involved. I know I can't undo what happened, but maybe I can help prevent it from happening to others. Tasha considered his offer carefully. Having Dr. Blake share his story and his transformation could indeed be powerful in helping other physicians recognize their own biases. It would require careful consideration and appropriate safeguards, but it might represent an opportunity to turn a terrible experience into a teaching moment that could save lives. I'll think about it, she said finally. The work we're doing requires authenticity and commitment, not just good intentions. If you're serious about making amends, you'll need to demonstrate that commitment over time. 3 years after her heart attack, Dr. Tasha Williams published a landmark study documenting the impact of systematic bias reduction efforts on patient outcomes. The research, based on data from multiple hospital systems that had implemented similar protocols, showed dramatic improvements in care quality for minority patients and significant reductions in medical errors related to diagnostic bias. The study became required reading in medical schools across the country, and the protocols Tasha had helped develop became the standard of care for addressing medical bias in healthcare institutions. Her work had evolved from a personal experience of discrimination into a movement that was transforming medicine on a national level. But perhaps the most meaningful recognition came from an unexpected source. She received a letter from a young black woman named Tiffany, who had been treated in the emergency department where Tasha's ordeal had begun. The woman's chest pain had been taken seriously from the moment she arrived. Her cardiac symptoms had been properly evaluated, and her life had been saved by the prompt intervention that followed. "Dr. Williams," the letter read, "I don't know if you'll ever see this, but I wanted you to know that your experience probably saved my life. When I came to the emergency room with chest pain last month, the doctors took me seriously right away. They ran all the tests, found the blockage in my heart, and got me the treatment I needed. I later learned that this might not have happened before the changes you helped implement. Thank you for fighting for patients like me." Tasha kept the letter on her desk, a daily reminder of why her work mattered and why the fight for healthcare equity could never truly be finished. Every patient who received appropriate care, every physician who examined their own biases, and every institution that committed to systematic change represented a victory in the ongoing battle for medical justice. The story that had begun with discrimination and near death had evolved into something much larger, a movement that was changing the face of American healthcare one patient, one doctor, and one hospital at a time. And at the center of it all was a woman who had refused to accept that her pain didn't matter, who had turned her worst experience into a force for positive change that would benefit countless others. The transformation wasn't complete, and it never would be, but it was real, it was measurable, and it was making a difference in the lives of patients across the country. Sometimes, Tasha reflected, the most powerful changes begin with one person's refusal to accept injustice and the quiet determination to turn personal pain into collective progress. And just like that, what started as a medical emergency dismissed by prejudice became a catalyst for systematic change that would save countless lives. This story reminds us that speaking up against injustice, even in our most vulnerable moments, can create ripple effects that transform entire systems.